A woman walks into an ER with chest pain, vertigo, and dizziness. The doctors run every test: EKGs, CAT scans, MRIs, blood work, no heart attack, no stroke, no cancer. Most doctors would just discharge her and send her home. But not today's guest, Dr. Adam Rizvi. Adam did something different. He sat down with her and asked one question: what is going on in your life? And then everything unraveled. A decade of buried pain, a commitment she'd abandoned, and a pattern of abuse she had fallen back into. And in that moment, with just his presence and his willingness to listen, this patient started to heal herself. But what I loved most about this conversation with Dr. Adam Rizvi, he does not see himself as a healer. He sees himself as a facilitator of love. Dr. Rizvi shows up with an open heart, and something miraculous happens. The body listens, the soul begins to speak, and healing starts to happen. I'm so excited for this heartfelt, warm, beautiful podcast with Dr. Adam Rizvi.
We need at our table of awareness the logician, but equally we need the intuitive, we need the mystic.
I almost died. I was allowed to go to the very precipice of death, of life and death, and look over the edge. And I was allowed to behold what was there and allowed to come back. Most people aren't.
When we talk about being aligned with ourself or being aligned with our soul or hearing our higher self, that's really what we're talking about, is being connected to that divine part of ourself, that light-filled part of us that is connected to God energy, that is connected to everybody here and every experience we've ever had.
If more doctors, more professionals can open up to use intuitive gifts in their work, that's really important.
Hi, I'm Dr. Amy Robbins, and welcome to Life, Death, and the Space Between. I'm a licensed clinical psychologist and medium, and here we explore life, death, mediumship, near-death experiences, consciousness, and what it all means. Before we get started today, I want to ask something of you. If these conversations have meant something to you, if they've helped you in a moment of despair, or brought you a step closer to the essence of who you are, I want you to know the best way to support this show is through Patreon. While there are some ads on this show, and I'm grateful for them, they only cover a small portion of what it costs to produce this podcast. Listeners like you help me cover the rest. And there's so much coming to you this fall, including a new cohort of my spiritually informed therapy training. If you're a therapist and you're wanting to bring more spirituality into your clinical work, or if you're just someone looking to live a more spiritually integrated life, you can check it all out on my brand new website, dramyrobbins.com. Thank you so much for your continued support. It means the world to me to be able to keep bringing you these fascinating conversations to help you and me learn and grow. Welcome, Dr. Adam Rizvi, to Life, Death, and the Space Between.
It's a pleasure to be here, Amy. Thank you for having me.
So you are a very, very, maybe not as very unique as in the past, but certainly pretty unique in terms of your integration of, you're a neurologist, you've worked in critical care, ICUs, and you are extremely spiritual. So, and you talk about it. I think that's the unique part, that you talk about these two parts of yourself. So can you tell us all how these two aspects of you came to be?
We were just chatting, actually, and I feel like this is happening more and more to many people, where we have the professional life, but the spiritual life is kept hidden. Maybe we don't like to talk to people about it. Maybe it's too woo-woo, or it just won't be accepted by the mainstream, by the public in general. And that's especially true of professionals, healthcare professionals, or just professionals in general. We keep that side close to the chest. Now, I've found that something is shifting, and you tell me if you've had the same experience, but in the last 5 to 10 years, there's more of a willingness for professionals, just anyone really, to start to talk more openly about the deeper aspects to life, the spiritual aspects, the non-physical aspects, the matters of the heart. And I've kept those two worlds apart for a long time, but recently with this shift that seems to be happening, I feel the need and the desire to talk about it. And it's come up a lot with how I engage with my patients, and that I find more and more that most patients are opening to talking about that, because the way we live our lives, spirituality, that kind of inner depth, is the most important thing for most people. But the fact that we don't have the permission to talk about it is what's changing, I feel.
Do you feel like that's changing because of how you might be showing up just energetically? Or do you have a sense of if that's changing with all of your colleagues?
That's a good point. Maybe the world is reflecting the shift that I'm making internally, and it does do that. That's a very good point. I've noticed that I'm able to have more conversations with colleagues and friends about these other softer sides of life topics than I have been in the past. 10 years ago, I probably wouldn't have broached these things to my medical colleagues, at least. But now it seems okay to do that. And the nice thing is we may disagree with each other, but at least it seems like there's an openness to at least to have the conversation.
What do those conversations look like, and what do you run up against in terms of their disagreements? I mean, you're a student of A Course in Miracles, right? That's a big part of how
correct.
You came to this work. And so I'm curious, like, what you run up against in this space.
Well, I can't recall the last time I've had major disagreements with people or with colleagues. But, the kind of conversations that I have is a patient, for example, dies in the ICU, and right before they die, they talk about seeing their loved ones who've already passed on, and then the family gets a little freaked out about it. But the nurse makes a comment like, "Oh, honey, that happens." She sort of reassures the family that this is part of the dying process. And then I'll reinforce that, and I'll say, "Yeah, I've seen that happen many a times. They're just seeing on the other side of the veil. It's normal." I think in the past, I probably would have not said anything, right? Maintain the clinical veneer, the professionalism. It's okay for the nurse to do that, but maybe not okay for the physician. Nowadays, I've seen it happen enough where I throw my hat in the ring, so to speak, and I'll share my experiences and the stories. And then the nurse and I talk afterwards about other experiences we've had and the wild things that occur in and around death. Sometimes I'll have a physician, say, "Yeah, I don't really believe in that kind of stuff." And that's fine. Great. The conversation ends right there, and we both are good colleagues with each other.
So I love your book, Love Does Not Know Death. And in it, you walk through both your experiences with death, practices around death, and your patients' experiences with death and what you've seen. So I would love to hear from you some of those experiences. I know my listeners would love to hear some of those experiences that you've witnessed that have just been so profound that they have taken your breath away in terms of what happens when we physically die. Like what happens from that point forward?
Yeah. There's different ways we could go about this, but I'll tell you there's two levels. The first level is what I think might have been what a lot of people talk about first, which is the fact that consciousness continues beyond death, beyond the death of the body. I think that even talking about that in the medical domain was risky, especially as a physician. I think more and more physicians, healthcare professionals, nurses are willing to say, yeah, in my experience, I believe that to be the case, or I've experienced that to be the case. Mm-hmm. Belief is one thing, but people have visceral felt experiences where they know consciousness continues on beyond the death of the physical body. And I've had all sorts of stories to prove that to me. The deeper, the other layer is what's been happening in the process of facing death. I see healing happen. Mm-hmm. And it's been occurring to me, and it's what triggered me to write the book, that the context, what everything is about, is healing. Like not just, we're not talking about the body getting better, but like deep healing, like soul level healing, spirit level healing. It's what we're here to do. And I've felt like people need to know that. They need to know that this is what life is about. Life is about that kind of healing. And death often is the spark or the catalyst for that kind of healing to happen. I mean, you can probably speak to it better than I could with your own personal experiences, but for a lot of people, the specter of death looming ahead, like getting an intense terminal diagnosis, that sets them on a deep spiritual path for many people. Mm. For other people, it's having the death of a loved one. For me, I'd write about this in my book. My dad dying, that was a pivotal moment for me. My life turned around, and I plunged into the spiritual path because I suddenly saw, oh my gosh, death can come at any time. I mean, my dad was 69 when he died. I was in my late 30s. Mm. That's practically another 30, 40 years, and then it's over.
Right.
Assuming I live that long.
Right.
And the truth is we don't know. So that's the deeper level. One is, consciousness does continue. But the deeper level, which I'm very fascinated about, is how do we embrace death? Not as something morbid, but as a doorway to deep healing. Mm-hmm.
And that's something that I'm super passionate about as well, because I think that death does in that way really it has the power to really transform how you live if you can touch it every now and again. And you face it every single day, right? I mean, you see death in a way that most people don't on a regular basis.
Yeah. And it has a very particular look to it. The body, the way the body gets cold, the color of the skin changes, the shape of the face, the way people breathe, the sounds that occur at the bedside. Death has a shape to it. It has a feeling to it. There's also the emotional layer, right? The way people face intense grief. I don't think death often is the first time someone faces really profound emotion, like an intense emotion. Mm-hmm. Not always. Some people face it in different ways. Right. And that's a whole other lesson. Like, how do you live life that way? I remember after my dad died in Istanbul because he was on a plane back to Washington, D.C., where we lived at the time, but he had a heart attack in the plane, and the plane needed to get diverted to the nearest city, which happened to be Istanbul. None of us had ever been there. And when my mom called us and said, your dad had a heart attack, the plane diverted, we're in Istanbul. I was like, Istanbul? What? So I was like, all right, I'm getting a plane ticket to Istanbul. Uh-huh. So we go there and long story short, my dad passes away in the ICU there. Mm-hmm. And I remember going to this large mall, getting to get some supplies for our flight back. And I looked at hundreds of people. It was a huge mall. And I saw, an old couple walking, a mom with a stroller, the kid drops the toy. And I'm just seeing like the spectrum of life. And I'm thinking, the thought that occurred to me was every single one of them is going to either lose a parent, a spouse, or a child. And then it dawned on me, the suffering of humanity is immense. And at that same moment came like this huge well of compassion, because I was dealing with my father, who I was really close with, And I just felt like, this is it. I'm going to go back to the hospital and I'm going to commit my life to embracing the suffering of others and helping them through it, because I can't, if what I'm feeling, everyone has to feel, then I'm giving my life to this. And that was the beginning of my change and transformation as a physician.
Were you already in the critical care?
Yeah. Okay. I was already a practicing physician. Yep.
But how you were showing up just changed completely.
Oh, totally. I mean, I feel I've always been.
I imagine you were a pretty
person.
Compassionate guy. I get that sense from you.
Yeah, I was kind and supportive, but something deep happened. Like when you really see and feel how someone else is suffering, it almost made everything in my life irrelevant. And I'm not dismissing that, my life, my wife, my family, all of these things, they're important. But I suddenly realized, like, okay, there's something else, like the sense of mission and purpose to help others really ignited in that moment.
Mm-hmm. And so what does that then look like in your work every day? Like when you are sitting with someone, I mean, you said that death has the power to really heal people. So I'm curious, how do you approach those conversations differently? What does healing look like? How do you see people heal so profoundly when they're faced with a terminal diagnosis?
Yeah. When I would say, initially how it looked was my being more willing to have honest, real conversations with patients and their families.
That is so huge to me.
Yeah.
Because I just find like that those conversations don't happen, right? As a physician, your job is to, and many physicians, I think their job is to just prolong life as long as possible.
Yeah, exactly.
And never address what's actually going on. But I cut you off, so go ahead and.
No, you make a good point. There's something that needs to change and is starting to a little bit. This idea that if someone dies in the hospital, we've failed as a healthcare provider. It's not true. Mm-hmm. It's not true. Death is not a failure. I think that not just the West, but mostly the West sees death as a failure. And we put youth and beauty on a pedestal, and then age and with it wisdom gets sort of relegated to the side. But in the ancient past, when we had the village elders, right, the age and wisdom were laudable. They're like, this matters, I think we've sort of inverted it, but something similar happens where if you're a physician and you gave the right medications and you saved the day and you turned things around and the patient survived and they walked out of the hospital, then you did good. You did good. And it feels great to do that. Mm-hmm. But then if the patient has multi-organ failure and we're throwing the kitchen sink at it and nothing's changing and they're slowly dying or quickly dying sometimes, there's like this dark cloud that lingers above us. And it's like, you failed. Mm-hmm. You didn't save that life. And I work with residents and medical students, and I have to remind them, some of them take deaths really hard. It's not your fault. You do the best you can with what you know as a physician. And if, having done so, the patient still dies, so be it. Mm-hmm. Now, here's the trick, not the trick, but what I've started to learn is once it becomes evident that death is inevitable, then approach the family like stage 4 lung cancer, right? Multi-organ failure. The patient's too sick to begin chemo or radiation. Okay, just one example. Can I show up at the bedside? Tell the patient that. Tell the family that. And be with them as that news dawns on them about what it means, about death being inevitable. Mm-hmm. And then ride the waves of emotions of anger and blame and judgment and accusation and grief and sorrow and shock. Like, can I ride those waves with them without judgment and with total love. And this answers your earlier question is nowadays, what that looks like for me in having these real conversations is a lot of listening, not a lot of talking, just being with. And it's my experience that a loving presence does more healing than words could ever do.
And that's what I was just going to say. Like, as you're talking, I felt like tears welling up inside of what a beautiful gift for a doctor, for a physician to be able to give a patient that presence of just knowing when someone's facing death and being able to hold that grief. Because I think that most physicians, one, they're not trained in it. So, right. I mean, do you even have a class in death and dying or psychology or?
The closest, I'll give credit to my fellowship program. We had a palliative care specialist basically coach us in how to have these conversations. I think there is a way to be trained properly to have these conversations, but you're right. Most don't have that. It's something you learn and pick up on the way. But I think more than just about physicians, it's also about each one of us. Mm-hmm. Like, how do we show up with each other when we're going through a really hard time? Before the call started, you were telling me about where you recently came from, and
I was just at a funeral for those who are listening or wondering. Yeah,
like when someone says, "Oh, my so and so died," how do we sit with someone who is facing death? Mm-hmm. It's sort of like a call to learn how to love more fully, love more unconditionally.
And I think too, as I was sitting listening to my friend give like she did the whole ceremony. Her mother was mixed religion, didn't really feel tied to any religion, and so my friend just did the entire ceremony. And to sit there and witness someone you love, I love my friend, share the story of her mother, who I never knew, and who, you hear stories in a way, like now I want to know more, right? Like we had talked about her mom before, but it was always sort of in passing. And then it's like you hear the breath of someone's life, and obviously funerals are usually about how wonderful someone is. And it's not always like that clear and straightforward, but there is like a fabric that's woven. And you look at this person who I know in one dimension, and they had photos around, and then you start to see how multidimensional people are and what their lives are like. And I knew her cousin from years ago. We worked together, so I saw her cousin. But to sit and witness that, it's painful, especially as I'm getting older. And I think I luckily still have both my parents. I think of like someday that will be me standing up there, and that feels excruciating. And part of me is so conscious about like wanting to turn away from that. But then also wanting to step deeper into that, because she read this beautiful poem about being a mom, and it made me like, it does have, if you can allow it to penetrate, it has the power to really shift how you live.
Yeah, it does. It does. That's what I love most about these conversations, is what death does to people if you let it. Mm-hmm. It suddenly makes life real. It makes you real. Mm-hmm. It allows you to be honest and forthright. I've seen families come together that have decided never to talk to each other again. People who have been estranged from each other come together when someone in the family is dying. And this is why I wrote the book, because I've seen some families, fate brings them back together when the father is dying, right? The children, the estranged children come back together, and either they can choose to just, grin and grit and bear through it. Like, okay, let's just get this through, get it over with. Like, dad's going to die. All right, funeral, let's go back to our lives. And that's like so sad because it's a missed opportunity. And then there's families who are like, okay, wow, we haven't seen each other for so long. Why is it that we stopped talking to each other? What was it? Oh my gosh, what a small petty thing. I'm so sorry. How are your kids? I'm doing fine. Like, and then the reconnection happens. And then like the grievances get dropped and forgiveness happens and the healing happens. That's if you embrace what death can offer you. Now that's the family, but as if it's your father, like maybe that's a chance to forgive what your dad did to you or said to you. Maybe it's a chance for the person who's actually dying to let go of their own regrets and embrace life. And there's one more thing I want to say, which is when we embrace death, on one level, it makes us appreciative of life. I think most people know that. That's like the obvious thing that happens. But there's something else that can happen, which is, and this is where the spirituality comes in. There's an invitation to look at what is it that I really am that does not die? What continues on? And this is like the quiet little unspoken secret in the spiritual practice of embracing death is like, no, there's an eternal part of you that you haven't been aware of yet. I've thought I was Adam, right? The story of Adam and all of his memories. You think you're Amy and the story of Amy and all the things that happen that define Amy-ness, right? But then when you and I inevitably will face our deathbed, that story is going to come to an end. So then what is it that's continuing onward? And that's the question that I think is most exciting. It's the deeper invitation to what is it that is eternal within us that we really are.
What do you think? What do you think is eternal within us?
I don't think it can have anything I say with words won't do it justice, which is why in the Tao Te Ching it says the real Tao cannot be spoken. He who says he knows the Tao knows it not, right? That's just using Taoism, but there are other traditions that say the same thing. And I think it comes down to, there's a great quote that I'm going to paraphrase from A Course in Miracles that says, a universal theology is impossible, but a universal experience is not only possible, it's necessary. And I think that universal experience is something we can come to. There's an aspect to this moment right now that doesn't change. And that's something we can start to touch. It's something that doesn't have a name. It's something that doesn't fluctuate. Thoughts, they come and go. Emotions come and go. The memories of things past come and go. So whatever is real about us has to be something that doesn't come and go. It's just always there.
Have you, in your work, have you had any shared death experiences?
Yeah. By shared death, you mean I experienced something as a patient dies?
Yeah.
When I was earlier on in my career, there was a man who had metastatic prostate cancer, and it had metastasized to his lungs and bone. And he was in a lot of pain and was having difficulty breathing. And his wish was not to be resuscitated if he died, but he wanted to try to get better. And he had a pneumonia in addition to the mets to the lungs. So we were treating his pneumonia, and his wife and his daughter were nowhere near emotionally ready for where he actually was. He was days away from death. And we all knew it. And we were me and the other ICU doctors and some of the nurses were trying to let the wife know, like, he is very sick. And because a lot of her conversation was, yeah, he'll get through his pneumonia and we'll start chemo as soon as he leaves the hospital. And
the denial, right? That denial kicks in. It's so powerful.
And it's tricky because you want to be optimistic.
Right.
You
And you have to be optimistic and realistic, right?
Yeah, it's a hard balance. So I sympathized with her, and at the same time, as a provider, you don't want to push someone who's in denial. Like, hey, ma'am, yeah, get real here. Like, your husband's gonna die. Like, that's kind of cruel.
Say your goodbyes.
Right. When some doctors do that, and that's fine. That's a style. But we were having this conversation and telling her, he's really sick and I'm worried he may not make it. I think those were the words I mentioned. She looked at me and pointed her finger, like intense anger. And she's like, if he dies, I'll know it's your fault. And it kind of struck me. And I said, okay, I'm sorry. I think this is, I didn't want to come across as upsetting you, and I'll just give you some time. And so I walked away, and she left, and I was doing a night shift, and I was doing work sort of forgiving her, forgiving myself for the guilt of maybe how I came across and all of that.
I want you to be my doctor. I mean, I don't, because I don't want to be dealing with what the things you deal with, but like just your compassion, it just like oozes through the screen.
That's very nice of you. I was doing that inner work when I was on night shift and sort of meditating, and I started to get these flashes of images in my head. And the first was an image of a kid running in a field. Then the next image was of a teenager kissing someone, and then someone getting married, like a young man getting married, and then another man getting having a baby, and all these images were, and I was like, why am I thinking about this? Like, who am I thinking of? And I was trying to think of, like, are these memories of someone told me, but I didn't recognize them. While this was happening, the nurse calls me and says, Mr. So-and-so went bradycardic and his heart just stopped. Can you come over? And I was like, oh my gosh, I was seeing his life review.
Yes.
And I come over and I just feel, it's this feeling of like, now I know you. And I see, and his heart stopped. Like, there's a big red 0 on the screen. And I just go over and I hold his hand, and I was like, I feel like I know you now. I know what you went through. I know your life. And I had this like huge well of love come out of me for him. And I'm like, you're just fine. You're going to be just fine. Go and go to your next stage in your journey. We're right here for you. We'll take care of your wife. We'll support them. We'll support your daughter. Everything's going to be fine. And me and the nurse were right nearby, and we were both holding his hand, and it just felt good. It felt like that was a great death that he had, and a loving one. And he was surrounded by love, even though it was two people that he didn't know in life, but it was still two people that loved him.
Mm-hmm. Oh my God. Okay. Need a moment.
Yeah.
It's just like so amazing I had another oncologist on once who had a similar experience where she helped like walk someone to the veil, and then confirmed later that she had asked the husband, did she have like a father that was like very, very, very tall? And she said, yes. He said, yes, she did. She said he was waiting for her when she got there. Like, it's just like to think about what you experienced as someone's soul was like making that transition. And we spend so much time focusing on what it feels like when a life comes into this world and how we bring it in, but we don't help escort it out.
It's so true. It's so true. And I think sometimes, like, what if so many people die in the hospital, not a lot of people die at home. And I just think, like, what if as a hospital we recognized the sacredness of the transition out of this life? Mm-hmm. And what if we could, and we don't always get to know when we're about to die, but oftentimes we can tell. We can tell. And what if the moment we know that that's going to happen, we can embrace that sacred moment, and we can come together and hold their hand and be with them, whether they're intubated or not, on a life support machine or not. At least there's someone at the bedside loving you as you make your transition. I think it'd be beautiful. And a lot of nurses, to their credit, are that presence.
Yeah. I mean, I know nurses are amazing with all of that. And now there is the field of death doulas. So there's many more.
Exactly. And hospice care.
And hospice
I know you've had
care.
a hospice nurse on your show. And I think that those kind of roles are needed.
Have you ever experienced a spontaneous healing?
I've had patients, not in the ICU, but I've actually had patients who come. I'll share one story, and I write about it on Substack. I had a woman come to. By the
way,
ER.
I love that you're in your bio and stuff. It's like Substack, my only social media. I'm like, I admire that.
It's too hard to do Instagram and other.
I feel you.
It's fine, and I like it. I just can't. I can only do one.
Right.
And I like writing. So.
I get it.
This lady came to me, and not to me, but to the hospital. She had chest pain, vertigo, dizziness, and we did our due diligence to figure out, okay, is she having a heart attack? Is she having a stroke? We can't afford to miss these things. So we got the blood work, we got the EKGs, we got the brain scans and the CT scans and all that, and the MRI, and we ruled out a stroke, we ruled out a heart attack. And I remember sitting with her in one of the small cubicles in the ER, and I just told her, like, tell me what happened, like, what's going on, what brought you into the hospital? And she goes into this big thing about how she's working with a realtor, and she's got so much stress at home, and a friend of hers or a family member of hers, I forget now, who was in jail for being an alcoholic and having a DUI, comes back home and then throws a rager at her house while she was gone, and everyone's drinking, and it makes her so upset that this person didn't turn over a new leaf. Like, they just went right back to drinking in her house, no less. And then I just said, that sounds like a lot of stress, like, just reflecting back. And then she said, you know what? I didn't even realize this, but today is, like, I think she said, like, the 10-year anniversary that I split up with my husband for alcoholism. And then all I said to her was, well, I don't think that's a coincidence that today is the 10-year anniversary. And something happened in that moment where she just sort of, like, her eyes got big. She's like, I don't think so either. Oh my gosh, I don't think so either. I've been thinking about this whole time. And then she goes into this whole thing about her journey with alcoholism, not for her, but, like, dealing with other people, and the journey of not tolerating abuse from her ex-husband, and standing up for herself, and that she made a commitment when she left him to be a new woman, and that she had forgotten that, and she got sucked into this new role of being abused again by her boss, and then realizing, like, today is an opportunity for her to recommit to what she had committed to 10 years ago. And she told me, it's like, I think my symptoms are gone. I think I needed to come here to realize this for myself.
But you were like such an angel, because a lot of doctors probably would have just run all the tests and been like, nothing's wrong, you're fine, go home.
Fair. That's true. Yeah. But one thing I firmly believe is, as healers, and you probably could vouch for this, we aren't really the ones doing the healing. Patients and clients, they heal themselves.
Yeah. I think I'm a facilitator. I call myself as a facilitator of healing. I'm not a healer. I don't heal people. I help people to heal, but I don't heal them.
That's exactly it.
Yeah.
Yeah. We all heal ourselves. And I think in that moment she healed herself, and she just needed someone to talk to, I guess, or someone to reflect back wisdom that she already knew about herself.
Well, and it seems like you just show up with such love.
Yeah.
And
that's the key.
Yeah, it is
just
the
love
key.
Each other.
When people are like, what's your theoretical, how do you practice theoretically? What's your theoretical orientation? I'm like, honestly, I think I show up with love and then some psychodynamic and psychoanalytic theory. But like, other than that, I really do show up with like a heart full of love. And I'm very blessed because I received unconditional love from my parents. So it's easy for me to give that love. And so that I think is so powerful in healing, just showing up in a presence of love.
Yeah. And there's this interesting thing that happens. The more we can love someone else unconditionally, the more we start to love ourselves, and vice versa. The more we can let ourselves off the hook, be a little bit less judgmental with ourselves, the more we're able to let the mistakes of others just be and accept and honor them despite the apparent flaws. It's like this feedback mechanism.
Yeah, it's beautiful. So how do you come to understand what happens when we die and where our soul goes? Soul, I guess we'd call it that. Eternal spirit, I think you called it earlier.
Yeah, both. I mean, yeah, either we have different language for it.
And have you ever seen a soul leave a body?
Yeah.
You have.
I don't know if soul's the right word for it, but I saw
energy,
something.
Maybe energy.
Yeah, maybe energy. I don't know. I'm not really sure. I'm a physician first and foremost. I'm a neurologist. I haven't received formal training in seeing energy and working with energy. There are people that you could probably talk to that are experts at that, and I would defer it to them. But I have seen moments where the patient dies, and I see something. I've seen lights change, like the room getting dimmer and then getting brighter, almost like someone's flipping a dimmer switch on and off, right? But nothing's happened. Like the light stays the same, but there's this felt sense that the light changes. I've seen wisps of something, kind of like the way it looked like was, how when you have an incense burner and you blow it out and there's like a little trail of wisp that kind of trickles before it stops. It kind of looked like that coming out of their head or out of their heart. I've seen different things happen. I saw one guy die with he had COPD, and it was like a lung disease. And then when he died, I saw this spinning whirlpool behind his head and off to the right. That was kind of interesting. And I saw the wisp.
I love how you're like, and that was kind of interesting.
Yeah. I saw a wisp of light come out and go to that swirling thing. It's just things that I see. I don't know what it means. You could probably interpret it as you see fit, but I think people have experiences, nurses, certainly physicians, that they probably don't talk about, but odd things happen when the body dies.
Wow.
That's for sure. Yeah. And I'll tell you one thing that I feel pretty firm about. The death of the body is not the end of life. It's not the end of identity. It's not the end of self. I've had patients die, come back, clinically die, and come back and then tell me, like, I had this happen to me. I met this person. I saw family members. And just from a strictly scientific standpoint,
and they are dead, because a lot of people negate that. There was just a whole write-up, I don't know if you saw it recently, of doctors that were negating near-death experiences.
Yeah. All I can say is that division will exist for quite some time. There are staunch materialists, and there are explanations for experiences that we have, like, hypoxia, lack of oxygen will make the brain fire in a way that causes hallucinations and whatnot. All I can say is, at a certain point, the anecdotal evidence starts to overwhelm the scientific justifications for a materialistic standpoint. That's all I can say.
Well, Adam, if people are interested in your work, if they want you to be their doctor like I do, tell us where we can find your new book. Is it new still?
It came out
newish?
A couple months ago.
Okay,
Newish.
That's still new. Your book, where they can find your work, Substack. Tell us everything.
Well, I'm working on getting a personal website. I was told I'm supposed to have one as an author. When that's up, it's going to be on adamrizvi.com. But the easiest way to get a hold of me is on Substack. My Substack is Adventures in Kindness. You can just Google Adam Rizvi Substack, and mostly it's stories about the lessons I learn with my patients and what they teach me. And I occasionally publish on Medium. You can email me if you want through Substack, and I read everything that I get, and I respond to everything that I get. So please feel free to email me. And I have a podcast about all things spiritual and comparative religion, if that's a different flavor of stuff that you're interested in, with my co-host Stephen Downs, and it's called Letters to the Sky.
Adam, thank you so much you're such a light in this world, and literally I feel...
As are you.
Oh, thank you. But like your love just like emanates through the screen. It's really beautiful. And I'm glad to know you. And I hope that people will read your beautiful book with there was so much to cover. And I was like, which direction do we want to go? So,
it was so fun.
Just thank you. Love Knows No Death is your book. And thank you for being here.
Thank you for having me.
And here meaning here in this world, not just here today.
Exactly. Thank you.
Like what you heard today and want to hear more? Wondering what comes next and what it all means? Head over to Apple Podcast, Spotify, Stitcher, Google Play, or anywhere you get your podcasts and hit subscribe. Also, if you could take a minute to rate and review my podcast, I would really appreciate it. Stay tuned as we continue to explore life, death, and the space between.